Welcome. My name's Conor Delaney. I'm Chair of Digestive Disease and Surgery at Cleveland Clinic. I'm here this afternoon with Dr. Scott Steele. Scott, thank you for being here. Scott is Chair of Colorectal Surgery for Cleveland Clinic. And maybe, Scott, you'd start off by telling us a little bit about the department and some of the cool things the team is doing.
Absolutely, and thanks, Conor, so much for allowing me to be here. You know, when people think about colorectal surgery, sometimes they don't exactly know what it all encompasses. And when I think about colorectal surgery, we talk about the 5 pillars of colorectal surgery, if you will. Do an endoscopy, dealing with patients with anal rectal disease problems like fissures or hemorrhoids, those patients that have benign disease to include inflammatory bowel disease, diverticulitis, disease processes like that, the colorectal malignancy conditions, colon cancer, rectal cancer, anal cancer, and then those patients who have pelvic floor disorders, rectal prolapse, some problems with defecation. So we think about it in terms of the hindgut, but it's really all over in having good GI wellness.
Yeah, it's really important and really complicated. And I think the team here is special because they also get to deal with a lot of reoperative and particularly complex stuff, a super group. But so tell me how you came to colorectal surgery. What brought you to this specialty? Because I think to many people that's maybe a little unusual or an area they don't think about, but what brought you to this?
Like many of us, it was through a lot of mentors and interactive kind of personalities that I really liked to enjoy the way that they dealt with patients and dealt with other colleagues. I always thought that I was going to be an orthopedic surgeon, and then I thought I was going to be a cardiac surgeon. But when I met some colorectal surgeons and kind of investigated what they did, I thought, what a neat field. Kind of the interesting, Conor, I think for years my wife would say at like parties when we'd get together, my husband's a surgeon, when they'd ask her what type, she'd say, you know, I'm not really sure exactly what type that was. But throughout the years, we really understood the importance of colorectal disease processes and how we can interact, and it's just been such a fruitful career.
Yeah, I think we're very blessed with what we do. The frequency of colorectal cancer and other things, we get to help a lot of people.
Absolutely.
So Scott, you've done some amazing things throughout your career, but one of the things you've done that's unusual for many clinicians is you've had a very heavy presence in social media, and you've developed a couple of incredible programs through social media. Maybe you tell us a little bit about that.
So it all started back in 2013. I was just home from a deployment. I used to be in the military, and during that deployment, I got introduced to podcasts. It was a time that I could download some things from a satellite. And when I got home, a few of my residents would say to me, hey, have you ever heard of a podcast? And I was like, for sure I have. And so we talked a little bit about developing a podcast that had looked into kind of the educational aspects geared towards residents. And we kind of talked about different dynamics of that. And I had a wonderful friend and mentor in Carlos Pellegrini, who at the time was the chairman of the American College of Surgeons at the University of Washington. And I called him and asked him if he would be a part of our podcast. And this podcast, we came up with the name Behind the Knife. And I envisioned it always as kind of like an inside the actor's studio type podcast where we could talk to surgical leaders in the field and not only talk about disease processes, but also talk about their background and how interesting it was that at that time someone like him could grow up in Argentina and become the president of the American College of Surgeons, or like yourself, grow up in Ireland and come over here and lead the Digestive Disease Institute here at the Surgical Clinic. Those stories are fascinating. And so that grew out of that, and we've had a wonderful time doing it over the last 6 years and having hundreds of thousands of downloads every month from around the world in over 140 countries. And when I got here to the clinic, I realized that one of the aspects that was maybe missing a little bit in the digestive arena was a patient-facing podcast. And that's where, through your support, and I thank you for that, we came up with a second podcast called Butts and Guts. And Butts and Guts it's a wonderful podcast that we gear towards our patients. They're about 15 to 20 minutes long, and we choose disease topics, both in the digestive realm and all of surgery, that really get to the aspects of what that disease process is about, what patients can expect as they're maybe going to the doctor and have some of that fear and trepidation, and then give a little bit of window in terms of the treatments and then what's on the horizon for that. So it's been an absolutely wonderful kind of venture that we've gone on, and I've had some wonderful times talking to great guests.
I think you've certainly accomplished so much with it, both for the residents and their training, but also for the patients and their perspectives. But with Behind the Knife, I understand you have a tagline or something with that. Do you want to tell us the tagline?
Yeah, absolutely. So my life motto, my credo has always been something called Dominate the Day. And when we were first taping the show, we didn't know exactly how to end it. We were sitting around a kitchen table, and I said, we should end it with dominate the day. And I kind of say it a little bit like that. And so when some of the people who listen to it a lot, they'll come up to me and they'll be like, say it. And I'll be like, what do you want me to say, knowing that what it is? And so it's one of those things that I just, more about anything, is getting the most out of every day out of your life and just really just pushing yourself to do great things.
That's very cool. Great story. So listen, Scott, thinking of all the things you've done again, and maybe thinking of here within the department or otherwise, what are you most proud of? What goes through your mind as something that's been fantastic among the many things you've accomplished?
You know, I think more than anything, being here at the clinic, the one thing that I've realized is the fact that, as you know, we have a long and storied heritage, and you know, dating back to even Dr. Jones and Dr. Crowell, and then really within our department by Dr. Turnbull and Dr. Fazio, and just having people that are out there that are really truly leaders in the field on all aspects. What we talked a little about earlier in terms of those pillars of colorectal surgery, what I can probably most proud of is that our department is so solid in terms of experts in leading the way, innovative strategies, all aimed at great patient care and great patient outcomes within every aspect of treating colorectal disease. And that lineage has withstood the test of time here at the Clinic because it really embodies what our approach is more as the enterprise in terms of patients first. And what I can tell you is that that's not just the model, that's something that's ingrained in our department. And so that's probably my favorite thing about coming to work, to know that the people who are out there leading it are also in the OR doing it and really taking care of patients.
Well, I can tell you, I'm proud to have you as a colleague and a friend, and I'm just excited about all the things we're getting to do together. So
well,
thank you.
Yeah, I appreciate it, and I really appreciate the opportunity to come on.
Well, thanks for spending a few minutes talking. So thank you all for being here, and I look forward to our next session in the near future.